Hello, everyone. I think almost done, almost time there, so we can start now. So everybody can hear me? Can you hear me?
Yes.
Okay, good. So quality is okay?
Yeah.
Okay, thank you. And today that I'm very pleased to have a chance, to introduce mini Zen acupuncture therapy to you guys. First of all, that welcome you guys to attend this free seminar and listen to my mini Zen acupuncture therapy. Because have been practicing acupuncture almost 30 years. So in last 30 years, I really feel the mini acupuncture therapy is very useful for our acupuncture therapists in Canada, in States, or in Europe countries, because it is very safe and effective. And compared to regular, fine acupuncture needle, this mini Zen acupuncture has more benefit than just the needles. Okay, let's start. Part one, introduce me and welcome you guys. So first of all, I would like to maybe introduce myself, my education background. Actually, that from 1983 to 1988, I was studying that in Nanjing University of Traditional Chinese Medicine, and I got my bachelor degrees in traditional Chinese medicine. And after graduated from the college, from 1988 to 1991, I was at the General Internal Medicine residency in the Jiangsu Provincial Hospital of Traditional Chinese Medicine, which is the biggest hospitals of traditional Chinese medicine in Jiangsu province. And then from 1991 to 1994, I got my master degrees of Chinese Western Integrative Medicine, in Nanjing University of Traditional Chinese Medicine. So I spent another 3 years back to the school. And from 1994 to 1997, I got my medicine doctor's degree in Peking Uni Medical College and the Chinese Academy of Medical Sciences, which is the top one medical school in China. So I'm very lucky, that I got chance to study in that college, and then to enrich my medical knowledge and experiences. And after I got my MD degrees from Peking Union Medical College, from 1997 to 1998, I was a research assistant in China-Japan Friendship Clinic Research Institute in Beijing at the hospital we call China-Japan Friendship Hospital. And then from 1998 to 2005, I was a postdoctoral fellow in University of Manitoba, Canada. So here it's kind of local, and also I used to work in the Brody Center. And since 2005 to right now, I'm working in my acupuncture clinic we call AAHC Acupuncture Healing Center, Winnipeg, Canada. So this is generally my background of the education. And in the last years, I had 2 books published in China. It's a Chinese version. Right now I'm working maybe to get the translate to English version. One is called the collection of the single Chinese herb application. Another one is a collection of single acupuncture points application. So they are very useful for acupuncture therapist or Chinese herb medicine doctor to learn how to use a single herbs and single acupuncture points, that in the clinic application. So that if you guys know Chinese, maybe you can contact me and get this kind of set. Or if you are English guys, that you have to wait until that I can translate these 2 books into English, and then that you guys can get it. Okay, so that above is my education background, and let's start. That using acupuncture the seminar. First of all, that I want maybe you guys to watch this video. We call John's, testimonial. He is my patient and also my friend over almost 20 years. And he's kind of typical, that Canadians, he likes sports and he likes exercise. And also he got lots of injuries from his experiences, his life. And he used to come to my clinic with my regular acupuncture treatment, and with more and more injuries that he found my regular acupuncture treatment doesn't work very well. And he stopped coming almost 5 to 10 years. And in the last 5 years, he started coming back again. And then that I started using my mini-zinc acupuncture therapy for him. Since then, he was very happy. He's very happy, that with my treatment. Every time after treatment, he always told me, oh, he was almost like win the $1 million. So that's the I asked him that to give me the testimonials to listen what he's talking.
All right. Hi, my name is John. I'm a 67-year-old male patient of Dr. Gojin, and I've been coming to see him for a while for a number of various ailments, but recently I've had lots of difficulty with my left knee. My left knee was generally my good knee. My right knee is more of an issue, but I do have osteoarthritis, and both knees are typical for somebody who's been about to be paneled for a knee replacement. Anyways, coming to see Gojin, I was experiencing great pain in my knee, great pain in my IT band, and after honestly walking in, I was walking like a man who was much, much older than I am, and it was shocking to me, quite depressing as well. And after 3 treatments, I couldn't believe it. The difference is incredible. I'm walking still with pain in my knees because of the arthritis, but I'm walking like I used to walk 10 years ago. And I feel like I have a spring in my step, and looking forward to getting out and being even more active than I've been. Hockey season's coming up, working on the end of the golf season, and it just feels so, so much better. I would encourage anybody who's got this type of pain, knee pain, ITB band, sports injuries, come and see Gojin, and I think you'll find the difference will be incredible.
Okay, so from his case, that I say that in Canada, States, and the Europe countries, lots of people like sports, and then that like hockeys, like skating, skiing, and golf. Lots of people that suffer from those kind of sports injuries, and with aging process, they get more and more troubles, that in the pain. So that's why we need more effective way to fix those kind of injury, that fix those kind of pain. Studying that, I'm not maybe quickly talk about what is pain, because when we talk about pain, that very common words, everybody knows that pain is pain. So that, but I think that we need to understand a little bit types of the pain, different pain. Okay, so generally pain can range from annoying to that debilitating, that very sharp pain or very dull pain. So that could happen. And also pain may be consistent or start or stop frequently, that could happen, or it can become a chronic pain too. And also the pain can be localized, affecting a specific part of your body, and also that that everybody respond to the pain is different. Some people have a very high tolerance of the pain, and while others have a no tolerance. So pain is highly subjective. So that is nobody can test or check out do you have real pain or your fake pain, because that is really subjective things that if a patient told you I have pain, that is has pain. You can say no, you don't have pain. And pain lets us know when something is wrong and give us hints about the cause. So that is very important things for our acupuncture therapists. when the patient come in and see you, that when patient tell you some part of body has a pain, actually tell you something happened, to this part of body. So you have to pay attention to that. Of course, types of pains. First of all, we have acute pain. Acute pain could happen suddenly. So injuries, illness, or medical procedures, all can cause acute pain. And chronic pains that can last and comes and goes, over multiple months or years. So sometimes we call it intractable pain. So that the causes of chronic pain is very complex. That could be from injuries. That just like John's stories, he likes the sports, or from kind of poor postures, that of the working condition, and also from that maybe accident, then that not got healed completely. So that is very, very complex. But anyway, that from one kind of survey that in 2019 say that in the States, almost 20% adults in the States have chronic pain. And also more than 7% and chronic pain that frequently limited their activities at work and in wider life. So that kind of, very, very common the conditions. And that's why that in States and Canada, lots of people use that kind of the drugs, and then to, stop pain that cause of accident days so very frequently. So that's a very bad, sad sense. And also another pain we call nociceptive pain. That is kind of, that because tissue, damaged, so that's kind of pain I think in our clinic, acupuncture clinic, we always treat those kind of pain. So this pain, develops in your skin, muscles, ligament, tendons, joints, and bones. So sometimes we call somatic pain. So it can develop in your internal organs, and then we call that the visceral pain. So this kind of pain may be acute or chronic, depends on the underlying cause. So you may feel achy, throbbing, or sharp pain. Okay. And next one is called neuropathic, pain. That means, of course, a nerve has been damaged, from some reasons cause the pain. And this kind of pain that is very common in our acupuncture clinic too, like shingles, diabetes, multiple, sclerosis, or cancer. Sometimes we say, okay, we can treat those kind of pain. And this kind of pain feel like stabbing, shorting, burning, or prickling sensations. So sometimes, honestly, I think those kind of pain is not easy to get treated and to get better. So I think we need more, that efforts to help those patients, with that the neuropathic pain. Next one we call that the functional pain. Functional pain that is caused by that, the kind of injuries or damages made to your body, but you don't know what happened. Sometimes I say most of the time from the maybe postures or bad habits, and they tend to be chronic or pain. Okay, so more than 15% of the world's population has a functional pain syndromes, part of research in BJA education. So this kind of pain, is very common too, though fibromyalgia, which causes the widespread pain throughout the body, like irritable bowel syndromes, which causes abdominal pain, okay, and TMJ pain, which causes jaw pain, chronic cardiac chest pain, which causes chest pain. So this all kind of we call the functional pain. This kind of pain, lots of people maybe they are not aware of that, and also that in clinic, lots of people will complain, hey doctor, after a few session treatment, why my pain still there? And sometimes you have to think about that is from the treatment part or from your patient's habit, posture, cause the pain, existing there. So that's most of the time we have to tell patients, what happened, and then what it should be, care about that, your body, the postures or habits, and then after that we can check up if our treatment works or not work. So that's very important part. So acupuncture and the pain. So generally from about the pain, type of pains, I think most of our acupuncture therapists think, oh yeah, those kind of pain we all can get treated. Yes. So of course, most of patients are looking for our acupuncture therapist. I think most of the reasons is that for the pain treatment. So we believe that we are the kind of pain experts. Why yes or why no? Why yes? Because that I said maybe that 70–80% patients in your clinic because it's a pain patient. That's why your most pain treatment, is by acupuncture, right? So we are the pain expert. Why not? Why not means that sometimes that those kind of pain you can help. Sometimes you can't help. Why? Because our technique knowledges, some conditions we need that kind of specific, that the tools, to help the patients. We have the needles, in our clinic, but just have one needle, that's not enough. That's why that some clinic we have the cuppings, we have the TDP, that the heating, that the lamps. We also have some kind of, the massage. We have some kind of cupping, that treatment too. And still, that some patients maybe worked very well. That after your treatment, they feel better. But some patients maybe still they don't feel right. They still don't feel any improvement after your treatment. So that's why I say it's kind of things we have to think about that. How can we improve our treatment? That effective rates and more patients, getting better from after your treatment. That's the issues I would like to talk today. Focus on this kind of points. And of course, that I think the most of advanced therapists, that they have learned the Chinese medicine part, the principles, right? So that we have to differentiate pain, differentiate the treatment by acupuncture therapy in traditional Chinese medicine. So, of course, we know we have few types of different kind of pain from traditional Chinese medicine. For example, what is the best method to treat cold type pain? What is the best method to treat heat type pain? What best method to treat insufficient type pain? What best method to treat the excessive type pain? By acupuncture and moxibustion. So I think that the answers, maybe you guys all know that, for cold type pain, I think moxibustion, the heating therapy is best, right? And how to treat that the heat type pain. To my understanding, I believe that the blading therapy is the best, but we can talk about in the future, that if you guys interested in this kind of topic, how to treat the heat type pain. And then what's the method to treat insufficient type of pain? Actually, to my experiences, I think that the subcutaneous needling, wrist and ankle therapy, acupuncture therapy is best, for this kind of insufficient type of pain. So what the best method to treat excessive type of pain? From my experiences, I think that my mini Zen acupuncture, I mean that with blend needle is the best to treat this kind of pain. But don't forget that, all kind of pain from traditional Chinese medicine, they are kind of mixed up, right? Heat and cold, insufficient, excessive, all the kind of mixed up. So in clinic, we have to use, all of them by the moment your diagnosis, and then to choose the right one for your patient. Okay, so that's the important part. And we all know that we have lots of the methods and acupuncture to treat all different kind of pain. Typically, right now in China, I developed almost maybe the 30–50 different kind of types of the treatment to treat all kinds of pain. Typically, I mean that we all learn from the fine needle, common method in local treatment. So I think 100%, our acupuncture clinic use the fine needles, to treat the patients, right? And of course, from the fine needles, we developed a lot of kind of different ways, that to choose the points and to choose the way to treat the patients. Fine needle treatment following the meridians or Yin or Yi Jing, or Ba Gua, or 5 elements, or different needle directions. We have all kind of different type of the treatment. And also that from the needles, we are also find needle in specific part of the body named as, for example, scalp acupuncture, wrist acupuncture, stomach acupuncture, auricular acupuncture, eye acupuncture, cheek acupuncture, subcutaneous needling, etc. So, it is very, very, complex. Lots of people use all different way based on their understanding. That the way of treatment, the way of the pain. So of course, they all that work very well. And also that we have manipulation, trailer, guasa, and cupping is all kind of way, another way to treat the pain from traditional Chinese medicine, right? And also that we have a bloodletting therapy, the live needling, acupuncture. So today we are talking about this part. Okay, so this is another way that we treat the pain. And also that right now that very popular in that, in physiotherapists or, that chiropractors, they use the dry needling, okay? So use the thick needle, the silver needling, all kind of, the different type of the needles, and then to treat this kind of pain. But they still that the regular needles, just the size different. Okay, so dry needling use that maybe the big needles, thick needling like yuan nizhen, that in China some doctors use that too, and the silver needling that they use of the lots of silver needles surrounding the pain areas to treat the pain. And of course, we also have the electric acupuncture, laser acupuncture. So sounds that we have lots of ways can treat the pain. But why we treat one pain, we need those all kind of steps. So that sounds like pain, it is easy to treat, and also it is difficult to treat, right? Otherwise, we don't need so many different kind of methods, that developed for the pain treatment. So that means that the pain treatment is not easy. So we have to choose right one for right, the pain. So here are the questions that from above those kind of methods. What is the best acupuncture techniques we should have? So that's very important because some kind of the techniques I learned before, I feel it's hard for me to understand how to master it, how to practice it, because lots of reasons. So basically, from my own experiences, I always ask the questions: what's the best acupuncture techniques we should have as acupuncture therapists? Can have most of pain patients. First of all, I think that should be simple. That easy to learn, right? So if very complex, you have to to calculate the date and time, location, and the pain, and then to figure out what kind of pain, what kind of treatment you need. It's too complex. Second one, that I think we need objective, tactics, not just guess. Okay, I guess, to this point, maybe help the patient. I guess, but at this point, maybe help this kind of pain. You just based on experiences, based on, some kind of, subjective, that the imagination that maybe works, maybe not work. So I prefer objective, that I can find exactly what it is and then use what kind of treatment and make sure it will work. Okay, so that is objective. Safe is number one for all our practicing in that whatever in Canada, States, and Europe, or in China, in any acupuncture clinic. So we don't want any troubles from the patients from our treatment, right? We don't want the patients sue us because our treatment, that have some troubles. So safety always number one. For our acupuncture therapist. So that's very important. And also we need very good results, right? Immediate, long-term, and cure. So that's the kind of three different kind of stages for our acupuncture therapist to the patients. First of all, patient coming to a clinic, you have to get treatment right away, and that patient see your result right away, right? And of course, we don't want just to get very temporary result. We also need a long-term result. So, and patient need long-term result too. So this doesn't like the chiropractor must sometimes that the patients maybe that the 6 months or years, because the cracked that the joints spines, and then that after 2 days they're getting better, and then 2 days later they come back again, and then do it again. So but from our the acupuncture therapist, we want achieve the immediate result. We also want to achieve the long-term result. And finally, we want to cure, the pain the patient has, because otherwise, that the still say that our techniques is not on the top, right? So that's we are looking for that. And also the techniques should be repeatable, that some techniques, some doctors use very good, the treatment result is very good. But when you use that, maybe it doesn't work. So this is the way that I don't think is the best way, that we have to learn, because that lots of personal things inside behind the techniques. That's not good. And also that I say easy for the therapist. I know some kind of therapy, treatment works very well, but of course, the therapist spends lots of time, energy, physical work, to help the patient. So after, for example, like massage therapists, they work very hard. They always achieve a very good result. But, one patient, you have to work around 1 hour, 90 minutes. So it is very, very hard for that, massage therapist, I say. But to our acupuncture therapist, we also don't want, to spend 6 minutes or 90 minutes to treat one patient, right? Maybe we want just maybe 5 minutes or 10 minutes. If we can treat the patient, achieve the same good result, why do we have to spend 60 minutes, 90 minutes to treat one patient? So that's the problems. And then no downtime. So when patients come here, that and then you give the treatment right away, patients getting better right away. So patients don't have to wait, that 30 minutes, 1 hour before they get treatment. So low downtime, actually lots of people, that is very happy for that, so if we can just spend 5-10 minutes to fix it, to help the patient the pain. So why do we need, 60 minutes or 90 minutes? So that's awesome. And also the patient should be comfortable, right? So during the treatment, we don't want patients get, screaming. We don't want patients get, that, tearing. And sometimes we need it if the pain is very, very, very bad. We need, that. But most of the time, we want patients to be also happy, okay, with our treatment and also after treatment, right? So that I think is the best acupuncture techniques we should have. If you guys agree, I think that's great. So that today I think we are in the right place to learn the new techniques. And the features of the soft tissue injuries. So this one that I will talk that maybe a little bit late. So, but basically that, that pain, tenderness, functional, disturbance, that's kind of more the features of the soft tissue injuries we'll talk about after. And part 2, my concerns. Because I say I've been practicing that acupuncture and Chinese medicines over 30 years. So I do, from my own experiences, I have lots of concerns as an acupuncture therapist. What we should have, what we should do, and lots of things. First of all, I want to ask you guys, so what portion of the pain patient in your acupuncture clinic? Maybe some patients, some acupuncture therapists, they are specialized in the fertilizer treatment, or some patients, that, or some acupuncture therapists may be specialized in the cancer treatment. Some patients, some acupuncture therapists may specialize in, and some kind of digestion system, the respiratory system treatment or kidney disease, whatever. But I want to know that I know that in our acupuncture clinic, most of the time the patient we have is a pain patient. So at least from 40 to 80%. In my clinic, I say around 80% is pain patient. So that's why my clinic just like the pain clinic. And second one, that is it difficult for acupuncture to treat the pain? So that's just good questions, right? Yes or no. Actually, that I say, no, some people say, no, not difficult at all. Why? Because points are everywhere in our human body. So where's pain? Where's point, right? So we can use needles very easy to get treated. So, but also I believe that lots of people, lots of acupuncture therapists here, they think, no, it's not easy. Sometimes it's very difficult, right? So easy and difficult, kind of relatively, that I think the balance, I guess, maybe 50% say easy, 50% may be difficult. Depends on what kind of pain patient do you have, how do you treat the patient, right? So that is kind of things, that if you think most of pain patients, it's difficult for you to get treated. Or after years later, you feel more and more difficulty, to treat those kind of pain patients. I think today's the lesson is good for you, because I will help you to learn how to treat those kind of difficult pain patient. Does acupuncture have good result for pain treatment? Maybe your answer may be yes, very good. Maybe you say no, not good at all. Why? So that's the sense that I think from our traditional Chinese medicine part, theories and principles. Actually, that thousands of years, we just follow this way to learn the meridians, learn the points, learn the differentiations of the symptoms, blah, 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 blah. But we still don't understand if when we treat the patient get a good result, how? When we treat the patient, but we don't get the good result, why? So we never know exactly reasons why, right? So I believe that maybe that as long as you are experienced the acupuncture therapist, you will agree, that is my opinion, right? We never know exactly reasons, which points, which needles help this patient, which, so that's which kind of techniques help this patient. You never know. And the rules behind the acupuncture to treat the pain from traditional Chinese medicine, right? I mean that from Chinese medicine, we say 不痛, 痛. I mean that the pain caused by the blockage, whatever from blood, dampness, cold, heat, flame, etc., block the meridians and then cause the pain. So from traditional Chinese medicine, the differentiations, we have the few different kinds of things to treat. If from the dampness, and we say that then we clear the heat and then removing dampness. That if the pain caused by heat dampness. And we have the warming up yang qi to dispel the coldness. If this pain caused by the cold and yang insufficiency, right? And also we have the treatment, activating blood flow to remove the remove stasis. If the pain caused by that, blood stasis. And also that we have the treatment softening the tight tissues to relieve the spasm. We call because of the muscles kind of that the cramps, ligament cramps. So that's kind of treatment. So from traditional Chinese medicine, our goal is that remove the blockage to relieve the pain. So 通则不痛, right? So that's kind of way is kind of that the big the role we want to go. So that's we always learn from this way, right? So next questions, my concern is, does acupuncture have objective evidence for the pain treatment? It seems it does, right? So for example, R4 points. So we always say Ashi points. We always say that where's the pain, where's Ashi? Where's pain, we get treated. Where is the points we need to get treated? But also it seems it doesn't. What is point? Have you ever think about that? What it is point, just point, is skin, fascia, muscle, tendon, ligament, what it is, how big? So all this kind of questions we have that in our clinic, right? So that many years that we always just feel something is right, something is not right. So just as the Chinese word say that all roads lead to Rome. Yes, we use needles for any part of body, we can have some kind of pain. But where is the accurate objective signpost points to guide us to the wrong, to treat the pain? Just like we have maybe that thousands, 10,000 of the road to the wrong. So which one exactly is go there? And is there any sign post beside the road tell you, okay, you go this way, and next one is well, next one is well, and then slowly you can go just like GPS, right? But the thing is that our Chinese medicine and the meridian acupuncture therapy, we don't have any signpost to tell us where to go, and then what's next, and then what's next, and then achieve the best result. We always just like that mixed up, maybe not, we don't know. So there's always kind of questions. Here that is that what's your procedure to complete the pain patient treatment? Because from my personal experiences, I assume maybe you do the same thing as I did before. For example, when patients coming, that the major complaint, to take patients in major complaint, medical histories, and then make diagnosis from traditional Chinese medicine, and examine pain areas, and set up position for treatment, RC points, and then leave needles in the body around 30 minutes, and cupping maybe 5 to 10 minutes, and then maybe give massage another maybe 2 or 3 minutes, and end treatment. And after treatment, how's the result? Maybe you don't know. Maybe ask patient, hey, how do you feel? Patient, oh, I feel good. Oh, I feel relaxed. Oh, no, I still have pain. They all give you different answers, right? Because before you start to get treatment, you never know that if your treatment works or doesn't work. After patient get up, you may ask the patient, but maybe the answer, if the patient say no, I'm still have pain. So what can you do? What do you do? Why the patient still have pain after your treatment? No changes, for example. So that's the kind of way that that this kind of procedures usually that I did before. I guess like most of acupuncturists, that they are doing. And this is kind of issues we have spent maybe around, when first patient come, we have to spend maybe 1 hour for a new patient. So next question is that, how do you deal with the patient who complains that the pain was not getting better after acupuncture treatment? So what's your way? That the answer to this kind of patient. Maybe that's all from my own experience before I had. First of all, make a next appointment. I don't know. Maybe that make a next appointment. I try different kind of the needles, different kind of points, to treat this pain, to treat your pain. But I don't know why. Anyway, I want to try. Maybe that I combine some herb products. I know some herbs maybe works for this, for example, headaches. I give this kind of that herbs. Okay, that maybe take some herbs maybe help you. And then that maybe I give that actual treatment. After the patient get up, oh, I still have pain. Maybe I give maybe that needles, to put on the pain areas. Maybe works, maybe doesn't work, because I don't know. Just because patients say I still have pain there, I just put needles there, right? I think most of our acupuncture therapists work in this way. Some maybe acupuncture therapists maybe say, oh yeah, after a few sessions, the pain still not getting better. Maybe they think, oh yeah, I'm done. I don't know how to treat you. Maybe you have to get another, the therapist, from physio, from chiropractor, from massage, from acupuncture therapist, because I'm here done. I don't have any way to fix up your problems. So I think that most of acupuncture therapists that have this full, that choice, that to deal with patients who complain the pain is not getting better after your treatment, right? So next, that the questions that the answers is RC points. So we all know the RC points, and also I believe that our acupuncture therapists, 100% our acupuncture therapists use RC points to treat the pain, right? So have you ever think about that? What is RC point? Do you pipette RC points with your fingertips ever or never? What is RC points under your fingertips? If you pipette your RC point where you put needles in, what it is? What do you feel it like is? So I think that most of our acupuncture therapists never think about that. Typically, right now we use the tube needles, that the tubes, that put in pain areas and the points, and then just that put needles, insert needles inside. We never maybe even want to touch the patient's skin. Just follow patient, that point. Hey, I have pain here. You put needles there. I have pain here. You put points there. Some acupuncture therapists may use some kind of that manipulation of the techniques to stimulate the needles, right? I know some acupuncture therapists they use very that we call pain-free acupuncture therapy. So that means that the patient doesn't feel at all the needles, that assume the patient should be getting better. So of course, the level even never to touch the point we put needles in. So that is kind of things that I think we have to think about that. Ashy points is very good, idea, but we have to understand what is ashy points, what you should feel it like. So that's why that in Chinese word we say to know that something is so, but not why is so. To know the hows, but not the whys. So whatever patients after your treatment, pain is getting better or not getting better. Result is good as you expected. Why? You never know. The result is not good as you expected. Why? Same thing. That's always in my years, that I'm thinking about that. Why I can't get an answer. If I treat this patient getting, he's getting better, or that I treat this patient is not getting better. I always want to ask me why. Okay, so next part, I want to talk about the way I treat pain right now with my medicine acupuncture. Of course, same thing. When new patients come in, I have to ask, that the pain, the medical histories, the pain, when it happened, how long did it last, and happened in daytime or in the evening, or intermittent or constant. Okay, we have to not. Second one, we have asked patient the location, where's the pain? Neck, shoulder, arm, low back, neck, calf, ankle, blah, 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 whatever. And also important is that you have to understand how did it happen? Because the procedure of the injuries always can give you a clue which kind of muscle, which kind of joint has been, that injured. So that's why we have to ask that. And then that I need, accurate diagnosis. I want to, analyze patient, moment, because I say when the soft tissue get injured, the patient some kind of pain will interrupt, that patient moment or range of motion. So some patients can or cannot, finish certain kind of movement. So from analyze this kind of, that the moment, you can tell which kind of muscle, which muscle has been injured or involved in this kind of pain. So decrease the range of motion, it is a contracting pain or pulling pain from the muscles, right? And also I want to know that the origin and the insertion of injured muscle, where it started, where it inserted. So that from the muscle, I can tell, that this pain, if it caused by, injured from this muscle. And then that also I would like to pipette, the pain areas, that to find abnormal tension on the skin, because that the skin is a very sensitive, organs of our body. Okay, so sometimes most of the time we just think that, when we get injured, we always just talk about the muscles. Right now that more and more people talk about the fascia, but I believe that the more, pain patient told you is from the skin, fascia, and the muscle. And the skin part is maybe almost 50% more than the fascia and muscle pain, the patient told you. So when you pipette skin, the tension is very important to find where the injury exactly underneath of skin is that fascia or muscle or tendon or ligament, what it is. So from there, you can get ideas how to treat the patient. And also important is that from the pain areas, you can find or pipette the tender, the nodules. These tender nodules could be the scar tissues, could be the trigger points. Okay, so that's very important for me to get treated the patient. So I have to figure out, all these kind of things, and then that I treat the patient. And of course, we need, that to set up patient in the proper position for the treatment, right? Some patients maybe need sitting, supine, prone, sideline, and standing. for treatment. So my treatment, not just ask patient lie on tables always, okay? I may ask patient to sitting for treatment. Maybe I ask patient to lie on side for treatment. Maybe I ask patient just standing there for treatment. Depends what kind of pain, what kind of diagnosis I have, what kind of muscle I found has a problem, which caused the pain. I set the proper position for the patient to get the proper treated. So treatment targets. From there, we have to figure out which that is my needle to work on the patient. First of all, I will go to the heart tension screening. That's why I explained already. And also, you have to go to the sensitive tender nodules or trigger points. So the tendons, the scar adhesive tissue could be like cold like string, very tight. Okay, so that is part, also we need to get treated. And also tight muscle, the bundle fibers, that like taut band. When we talk about, that the trigger points, we always say trigger point is on the muscle's taut band, not the whole muscle group, just part of the, taut band. So that is also the target. My mini-zinc acupuncture did work on that. And also, I need also work on swollen the vein vessels. Why we have to work on the swollen the vein vessel? Because, for example, if that happened in the Wei Zhong Xue, right? So there that we can very easily just use the big needles, just take some blood out, and then maybe can help relieve your pain right away from that no back pain or back pain. So that is also that clue or sign part you can use to treat the patient. And also, I don't leave the needles in the body because with mini-zinc acupuncture, I only need just up and down insertion and cut off. Don't leave the needles in the body. That's why that I don't have to wait 30 minutes, 40 minutes for one patient. I just need seconds, for each point to treat the patient. So that's why I only spend 5 to 10 minutes to treat a pain patient. Just like I say that as long as you find the right place, use the right techniques and the weapons, and then you will get the right result. Just like right key to right locker. That if locker is there, you don't have the right key, you never can unlock. And also just like this, in the room, the lights, we need that the switch, right? So to turn on the switch, and then that we can turn on all the lights. Turn off switch, all lights will be off. So that's same thing. You have to find the right place, right thing to do right things. So effective rates, 100%. That I can almost guarantee that all patients, pain patient come here, at least when I give treatment, they feel better. But after treatment, depends the conditions. Sometimes I say I don't want to say that mini-zinc acupuncture is 100% for all the pain conditions. Okay, I say most of the time here I mentioned is the soft tissue injury pain, not the cancer pain. Okay, not the kind of genetic, some disease, that I can't do that. So I hope you guys understand, that my meaning is that the soft tissue injury pain. And from there, that I would like maybe share my that embarrassing experience before I had that in my clinic, some kind of very bad experiences. And yeah, I remember one patient, he's still here, called David. That time, that 15 years ago, he was my clinic, and he said he had chest pain. And then that time he told me, "Hey doctor, touch here. This nodule, it's very painful, it's very tender. That I just guess I get maybe heart disease, a heart attack." Actually, he went to the emergency 2 times already because chest pain. And I found, that the tender nodule is there. I tried to work very hard, use needles, acupuncture needles, cuppings, electricity acupunctures, and herbs. None of it worked. I spent, that 30, 40 minutes for him. But when he get up, doctor, no, not getting better at all. I, he pay me, I spend time, but I didn't get any result. So that's why I feel so embarrassed, because that I can't help him. And after that, he come back almost 10 sessions, slowly getting better. I know he's getting better not from my treatment, from its natural way. So that's why some patients, some therapists ask patients come here 10, 15, 20 sessions, because they know with time goes by, the pain, the inflammation will slowly getting better by itself. So that is hard to say. And also, from our experience, I feel that tingles numbness, that is very hard for me to get treated. When patients complain, "Oh, doctor, I have tingles, numbness on my hands, on my legs, on my bodies," I just feel kind of, what can I help you? I don't know. With acupuncture, 30 minutes, after that, none work at all. And also that I tried to use the herbs, of course, want to, that the 25 chi, promote blood circulations, remove the blockages from that, that the coldness and dampness, blah, blah, blah. Sometimes works, sometimes doesn't work. But at least from acupuncture part, I scared to take those kind of patients because I don't know how to treat those kind of patient. I scared to ask patient, is your pain getting better after treatment? Because sometimes just I say that I don't have any confidence to make sure after my treatment, the patient pain will getting better. Because at the time I just follow, the acupuncture points and ask points, I don't know. So that's why I scared to ask patients, I getting better. And also that to increase my patient volume, I have to do, do lots of advertisement, and then to get more patients coming. But I know that my treatment result maybe is limited, but maybe from advertisement, I get more patients coming, and then can increase my income. Yes. So that I feel so embracing right now that I think that the time I did, so right now I don't have any advertisement, that in local newspapers. Okay, so that when we talk about the pain treatment, I mean, not the patient, not the acupuncture therapist say, yes, my pain is very easy, but some pain we call the intractable pain is very hard to get treated. So that's what we call intractable pain. This kind of pain, that from definition says that it is not, curable. You have to take the that painkillers, of the rest of life, that you have to take the painkillers because it is incurable. Why it happens after intractable pain? So from my understanding that I say, first of all, the bad habits, when walking, standing, or in your workstations, always have some bad habits, bad position, postures. Of course, it will cause constant, that pain. So this pain, you can't, that treat by yourself or from the acupuncture therapist. You have to teach the patient, to correct their bad habits. And also that over-exercise or lack of exercise, just like John's stories, that of course, if they over-exercise, they will get lots of pain. And of course, some people never do any exercise. Of course, they will cause some kind of pain too. This kind of pain also kind of intractable pain. And also that I say scar adhesion tissues caused, by the injury. That's the kind of pain is main the reasons, that I will discuss that in the next part. And also the trigger points, myofascial trigger points is main issues too. So that's why with aging process, we have more and more trigger points in our body. That's why we call myofascial trigger points cause the pain. And then secondary injuries, that after you treat the pain, and then patient injured again and again, again. The pain never stopped because they always injured. So that's all kind of reasons, cause the intractable pain. So why is that the scar adhesion is one of the intractable pain reasons? So here that I just tell you very briefly, that adhesion between the soft tissues, can cause the problems. And also secondary injury from inflammation also cause the pain. And then from both, they will have the vicious, cycles. That's why the cause, that the intractable pain. So I will discuss more that in the next part. So my fascia, trigger points are the, the targets treated by PT or massage therapist. Because trigger points, that are degenerative illness of the soft tissues by aging process, I say. Actually, some research indicated that from the kids 4 years old, they start to have the latent, the trigger points. Of course, with aging process and more, active trigger points or latent trigger points show up. Okay, and also that it is kind of inflammatory, swollen the nodules. So that's why from pictures, we can tell. And also it was stimulating the peripheral, the nerve ending. That's why it caused the pain. So that's why that that the PT and the massage therapists, they always to treat the part because they can find it very easily to find it and very tender. And then that that they use their way, sometimes can achieve a very good result. So here, right now, why dry needling is getting popular? That in the States, in Canada, in the European countries. Why? Because dry needling generally, it is very effective to relieve the pain, but it has advantages and disadvantages. Advantages is that it is objective diagnosis because that gives a map. You can find all the trigger points, and then that you can use a finger pipette to find those kind of trigger points. So you can find it right away. And also the series, very simple, and that the operating treatment itself is very simple too, and also most of the time it can achieve a good result. The disadvantages, that is very painful. Lots of patients told me that from whatever pain doctors that give the dry needling, they say, oh, it's very painful. And also that the long-term results sometimes not great. And also to the scar, tissues cause of, the pain, they don't have the result because it is just a regular needles. It can cut off the collagen fibers to break up the nodules. So that's why to some kind of pain, doesn't work very well. Some kind of pain works very well. Here are the trigger points map, that I just, get copied from that, online. So that it just shows that everybody knows that they have kind of maps, and then that you can look for those kind of, trigger points and treat those kind of pain. Here, the questions for our classes is that, do you want more patients to visit your clinic? If you say yes, that maybe that this course is good for you. If you say no, I don't care, maybe that you don't have to spend time here, And do you want to be an expert of the pain treatment? You say yes. I think that it is worth for you, staying here to learn this kind of new techniques. If you say I don't care, I say maybe you don't have to waste time here. When that you treat the patient, do you want, accurate diagnosis, accurate treatment, high efficiency of treatment, immediate result, long-term result, acute pain, turn off cell phone to sleep, and so this all kind of ways that we are looking for, right? If you say no, I don't care about that. So, and then maybe don't have to stay, stay this course because that we want to teach you to do that accurate diagnosis, accurate treatment, high efficiency treatment, and also immediate result, long-term result, and cure the pain. And also because it is safe after treatment, you just turn off your cell phone, go to sleep. You don't have to worry anything. So that's the way. So from there, when we talk about the mini Zen acupuncture, we have to talk about Dr. Han-Zhang Zhu, who invented acupotomy. That means the life leaders. Okay, so my mini Zen acupuncture leader is kind of life leader, or we call it blend leader. So Dr. Zhu that developed this kind of techniques in 1976 in China. As a modern acupuncture treatment, it has been used to treat patients with pain caused by various diseases and can be used to remove chronic lesions in soft tissue. To date, sufferers cured by acupotomy total 100 million in China. 300,000 undergo needle life therapy every day in China. In 2000, Professor Zhu was accepted as a member of the American Academy of Experts in Traumatic Stress. In 2001, in order to honor the contribution done by Professor Zhu, International Scar Registry registry named as Star of Canis Minor. The number is A7H19AM30. I don't know. I don't understand that. It's called Zhu Hanzhang Star. So actually, that in China, that Chinese government, give him very high honor because he invented this kind of, that acupotomy, that the knife needle therapy. Here is Dr. Zhu Hanzhang. That actually, unfortunately, he was passed away maybe 10 years ago. Okay, but it has statues in his hometown, and this is the pictures of Dr. Zhu, and also his book, the book. So he did great, distribution to that, soft tissue injury pain by the, knife needling. So enlightenment of acupuncture in China, so that there, because we all know that acupuncture, that invented in China and has been practicing in China over 1,000 years. Why his acupuncture become more popular now in China? That must mean something, right? That means either way, this kind of treatment, the result is much better than regular acupuncture therapy. And also it, that should have some kind of extra benefit than regular acupuncture. So here they say the advantages of small needle knife therapy method is simple, less painful, quick to take effect, changing the pain disease treatment from incurable to curable, from complex to simple, from intractable to rapid healing. So it is very popular among the patients. So that's the advantages from that acupuncture from there. Because before, lots of patients suffering from the, for example, scar, adhesive tissue, the pain. Either way, you have to go to the surgeon to the surgery. But after surgery, maybe get the secondary injuries and more scar tissues around the surgery, the surgery areas. But with this kind of treatment, we don't need any surgery. Put needles inside, directly to break up those kind of scar tissues, and then the patient getting recovered right away. So that's why it is very, popular right now in China. And here that I want to share the one that that my patient called Sharon's knee pain treatment experiences, because her knee condition has been over 3 years. That actually surgeon be ready for his knee replacement surgery, and then after he come to see me, only that 3 or 4 sessions, her pain is much better, function is much better. Yeah, let's listen to her speech.
Hi, my name is Sharon and I am from Winnipeg. I fell at work 3 years ago on my knee. I was unable to walk around. I was constantly having knee pain, knee swelling. My knee was constantly knocking out on me, where I was unsure of taking my next step forward. I seeked out medical treatment. I was doing physio twice a week for basically almost a year. Been followed by orthopedics. I was then referred to orthopedic surgeon, and they suggested to have knee surgery, and that was going to be involving anchors and about 6 weeks of bed rest. Could not do that, so I knew I had to seek out other treatment. I began to do my research on acupuncture, and I came across Dr. Hung, and I decided I have nothing to lose at this point and everything to gain. Day one when I seen him, I was unable to walk. I can't do any kind of bending, no twisting, so I've been taken off of work. I've been off work 14 months. After my 3rd treatment, I no longer had the pain. My knee was no longer knocking out on me, and I could feel I could take 1 step forward without any concern whether or not my knee was going to give out on me. Acupuncture has been my lifesaver. Thank you very much.
Yeah, so her the cases, that I say can typically that say that we change that from this kind of incurable, that the disease becomes a curable, the disease, and change from the complex to simple, change from the interrectal pain to the, rapid healing process. So that right now he get only that 4-session treatment, she's much better. So that's why that I say this kind of therapy, it is very, very, worth for our acupuncture therapists to learn to practice for those kind of, intractable pain patient. So here that I would like maybe talk about a little more about scar adhesion tissues and negative that impact to our human body. And because we all know the scar tissues come from the soft tissue injuries, and and consequences of the healing process, and then it will exist in our body. Scar tissue is the body self-healing product after soft tissue injuries. Scar is a fiber collective tissue with high tolerance and poor elasticity, which makes it difficult for the body to digest and absorb. When adhesion occurs at a certain point or part of this soft tissue, muscles and other soft tissues cannot stretch and slide freely in our body, causing imbalance in the body's dynamic movement into physical dysfunction. At the same time, the adhesion is pulling and squeezing the nerves, causing the pain, tingles, and numbness, swelling, and soreness. So here is just kind of pictures of the, you can see the fascias, arteries, and nerves, blah, 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 has been all that compressed by the scar tissues here. So you guys can think about that with this kind of, that pathological conditions, with our acupuncture treatment, stimulate points can release this kind of, compression or not. To me, anyway, I don't think so. So we have to need some specific treatment to break up those kind of scar tissues and then release those kind of compression of arteries, nerves, and fascias, from the scar tissues. So that's why I say that the blood needle is a powerful weapon to treat scar adhesion pain. Okay, so due to the scarring and the adhesion, that circulation are often blocked, leading to local muscle atrophy and swelling. And if there is a large area of scarring and adhesion, it will also cause certain muscles and ligaments to squeeze and thicken, shorten, harden, and reduce elasticity, resulting in abnormal human appearance. Generally, acupuncture needles can only penetrate the scar collective tissues, but cannot cut off. Only a blade can cut off the scar and collective tissue, relieve the pressure and friction on other soft tissues, eliminate the pain and numbness, and improve the blood circulation to promote healing process. Here is kind of, that I did, examples, the how that, the scar adhesive tissue lock the muscle movement and how does it, that the medicine needles to break up. So that just maybe 2 minutes.
Today, I would like to present how to use our mini zinc acupuncture needle to break up scar tissue. These two file gun represent normal muscles. These wraps represent the skin and normal soft tissues. In normal physiological conditions, they should move very smoothly up and down, back and forth. But in case the muscle got injured and then scar tissue formed, this muscle movement will be interrupted. For example, we have a string here, just represent the scar tissues between, because there are no any elastic fibers between, so it's hard to move them. And then how to break up the scar tissues, because in our acupuncture clinic, most of the time we only use this regular acupuncture needles. Of course, we can try to break up, but most of the time we can go through, but it can't to break up. But if you use mini zinc acupuncture needle, and then it is very easy to break up because it has that very sharp blade on top of the needles. We can directly to cut it. Yeah, and then the scar tissue will break up directly, and then the muscle movement will back to normal. So that's the differences from mini zinc acupuncture needle and the regular acupuncture needle for scar tissues. Thanks.
Okay, so that this kind of that the videos just explain that how that does the scar adhesion tissues lock the muscle movement, and how does the mini needles with a blade to cut off those kind of scar tissues. So that's why I say that also from this point I say the blade needle also is the best solution to break up the myofascial trigger points. Because we all know that myofascial trigger points is a painful or tender nodules too. It can increase the tension inside the nodule and outside tissues, and it has tons of pain chemical substances stimulating nerve ending to cause the tenderness and the pain. It causes microcirculation inside of the nodule, which causes tissue necrosis. So MRA blade needle is more effective to release abnormal tension of that the myofascial trigger points nodules and wash out the chemical pain substances. So MRA blade needle can improve the micro circulation around trigger points to promote healing process. And also MRA blade needle can directly cut off the collective tissues of scar and the trigger points, which compress the surrounding soft tissue, blood vessels, and nerve fibers, very effectively release the pain, tenderness, and the tingles and numbness. So MRI needle stimulating action can help loosen up muscle cramps, release muscle stiffness and the pain. So from here, a lot of people may be worried about that. That here they use blade needles. Some people yes, some people no. No, I'm afraid of using blade needles. Why? So that's a good question, right? Another maybe kind of silly question is that is to use the knife in the kitchen. Oh, that's so silly. Yes, of course we use that knife needles. We use the needle that the knife that in the kitchen. Yes, right. Why? Because we need to the chop that chop those kind of that the vegetables, the meat. Of course we can just use needles. We need the blade, the knife to cut it. So why do you dare to use the knife in your kitchen, and you're afraid of using the blade needles for treatment? Because safety, right? You worry about safety. You don't want cut off the nerves, blood vessels, or cause any kind of damage to this kind of important that the tissues, right? Just like me too. When my son that starting to use that knife in the kitchen, I worry about him. I don't want he cut his fingers because of the use of knife. But after a few times of the training, everything's okay. He's fine. He never cut his the fingers when he used knives in the kitchen. The same thing. As long as we have the proper training, that very easy to learn that, and also we tell you how to safely to use that that blade needles in our practice. So you don't have to worry about that. Okay, as long as you can use the knife in your kitchen, of course I guarantee you can use the needles in the clinic. So that's why I say, can we use blade needle in acupuncture clinic? My answer is yes. It's big yes. Of course, that who are qualified to learn the blade needling? Because this is kind of questions, because we want person use that properly. Okay, so if you want to learn the techniques, you have the motivation. You are a caring person. You are responsibility. You have responsibility. You have the passion for learning, and also you are bold but cautious. Okay, and also you have basic knowledge of the anatomy, and also you have the certain clinic basis of acupuncture. So this things I think important for you to use this kind of special needles in your clinic and to help your patient, because we need that the care, that caring. We need very careful to perform this kind of treatment. Okay, we don't want that to injure any person in the clinic. Safety, I say, always number one in our clinic. So why Chinese style acupotomy is not suitable to our clinic practice? Just like I mentioned, that before, Dr. Zhu and Zhang invented this acupotomy in China and right now getting very popular. But that is a Chinese style acupotomy. That is not good for us because in China that they are in the main medical system. They most of the time that perform this kind of treatment in hospitals. Okay, they have that lots of support. But in our clinic in Canada, in States, in Europe, our that regular acupuncture clinic, we don't have those kind of support. That's why. So here are the reasons. So the acupuncture therapist is not a physician in our medical system, right? We don't have that, the prescribing rights, and we can't give patients, that anesthetics drugs. We cannot, directly perform micro-invasive surgery and advanced imaging, that the technology. We have low post-operative care system to support. We do not have a professional medical team support. So that means that after surgery, after those kind of acupuncture in China, the patient will stay in hospital for 3 days to 1 week to make sure everything is safe. And after discharged, but in our clinic, we all only have that outpatient, that acupuncture clinic. We don't, ask patient to stay in clinic overnight, right? So that's why there, they have very strict, that procedures. But in our clinic, we can't do that. So the reasons we can't perform regular acupuncture in Canada, because it needs, that anesthetic drugs to freeze the pain, because they get very deep, treatment to the bone. So that's why that kind of painful. They need some kind of drugs to freeze. And also it needs, that echocardiographic equipment to help accurate diagnosis and treatment, like ultrasound, MRA, and then that they can perform treatment directly and do that, that those kind of imaging. And also it needs, special operating room. It needs medical team support. It has more bleeding during treatment. It has more risk to injure blood vessels, nerve, or body supportive system. So it may cause secondary scar and adhesion. The needle could insert very deep on the bone surface to perform treatment. The technique is complex, not just up and down insertion, but also needs peering in different directions. It needs very solid anatomy knowledge and experiences. I believe that in our clinic we can't do that. That's why I say we only can perform our own, that minizing acupuncture therapy. So what kind of acupuncture meets our requirement? Safe. We don't want any troubles. Mild pain. We don't need any drugs to freeze the pain. Effective. We also need, very effective, that the result. No side effect. We don't want the patient get any side effect from treatment or from drugs. No need unique equipment or drugs. We just have regular acupuncture clinic. We just need this kind of needle. That's it. No needles, no need special treatment room. Yeah, and simple and easy to operate. So that's the way that kind of acupuncture we need. So I say minizing acupuncture is the best choice if we want to perform this kind of treatment with blood needles, because it is safe, it has mild pain, tolerated by most patients, effective, no side effect, no need special treatment room, simple and easy operate. And also the benefit is that treat deep nail pain in the superficial nail, skin, and fascia. So that is very easy, very fantastic. The techniques, that we treat deep nail pain. Okay, so here that we have introduced that the minizing acupuncture more details. So what is minizing acupuncture? Is that that developed based on traditional tiny knife needle to tackle the superficial fascial nodules, muscle spasm, and scar tissue adhesion. It's very effective, revolutionary, minimum invasive therapy to treat various soft tissue injury pain, nerve compression, dysfunction, etc. The treatment features are the needle tip blade edge is very tiny, only 0.35 to 0.5 millimeter. The pain is mild and tolerable by most patients without any drugs. The therapy is very safe, same as regular acupuncture needle. which it may cause when neither bleeding or no bleeding at all, to avoid secondary damages. The treatment process is easy and pleasant. Each session of treatment lasts only around 2 to 10 minutes. Treatment frequency is once every 3 days. The general course of treatment can be 1 to 3 times, and 30 to 50 patients can be seen in 1 day. And fourth, the treatment process is very safe. The insertion depth is typical, less than 1 centimeter, and will not damage big nerves or important blood vessels in deep layers. The treatment method is simple with early up and down insertion without longitudinal or lateral peeling or other manipulation technique. It does not need other combined therapies such as massage, cupping, etc. Of course, you can, but you don't have to. The therapy supplies accurate treatment by finding the injured muscle fascia based on the patient's movement disturbance. The treatment targeted tissue include deep and shallow fascia, tendon, superficial muscle attachment, and muscle spasm trigger points, cutaneous nerve compression sites, etc. And the curative effect is immediate, such as that the neck pain, dizziness caused by cervical spondylosis, or low extremity numbness, low back pain caused by lumbar disc herniation. The long-term effects are even better. Diagnosis and treatment are objective and reproducible. The treatment effect can be confirmed by whether the painful nodules are eliminated or not, based on fingertips palpating. The theory basis is very simple, objective, and scientific. It is easy to learn and to practice. So that's all kind of features for minizine acupuncture. Here I want to that the confirms I say MRA is very safe because the minizine acupuncture needle is to use very small 0.5 to millimeter blade needle to cut off the stent scar and adhesive tissue to restore normal function of skin, fascia, muscle, tendon, cutaneous nerves, sympathetic nerves, and motor nerves. The myofascial or extrinsic support system of the human body is generally located in the superficial layer or under the skin. So the needle depth is only 1 centimeter. Cutting off or partially cutting off this scar adhesive tissue will not affect their muscle functions and will not cause substantial damage to the structure and function of the human body. So that's why the treatment strategy is very safe. And also that because important nerves and the blood vessels are generally in deep part of the body, the cutting depth went to 1.5 centimeter will not threaten them. So MRA is very safe, which greatly guarantees the safety of the patients and doctors. Because the blade is small, there is no need to use drugs. Okay, avoid the risk of patient death caused by this drug, allergies, or accident. So minizine acupuncture clinic applications, since the Professor Zhu invented this kind of tactics in 1970s, as a unique microinvasive technology in China, it achieves a great success in the treatment of soft tissue injuries, internal medical diseases, surgical diseases, gynecology, orthopedics, and ENT diseases. According to incomplete statistics, there are more than 300 indications for acupuncture medicine. So here are all kind of lists. I don't want to have to maybe read it, but generally it works very, very widespread of all kind of disease. You can use that. My own experiences of use minizine MRA in last 10 years. Since I started to apply the minizine acupuncture 10 years ago, I have deeply realized that the minizine acupuncture is a miracle therapy that fascinated me. It has a magical effect to many diseases. Meanwhile, the advantages of this therapy are time efficiency, amazing immediate result, and better long-term recovery. And to my own in last 10 years, I have been used MRA treatment, to treat those kind of pain, disease, dizziness, headache, cervical spondylosis, various nerve compression disorders, anxiety, pain, disease, Parkinson's disease, END disease, eye disease, allergic disease, blah, 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 almost, that 40 to 50 different kinds of, diseases. And also I treat, 20 to 30 patients every day with MRA. I'm always achieve guaranteed result. Here I want to show that, how do I perform treatment? Because maybe not people are wondering, how do you do that? Just show you.
Better. Better? But here also could be that, that comes from there too, because some kind of, that treatment could happen from there, from there, from here.
So this cases we treat all low compression.
Yeah, maybe to get up to see, stand up to see.
Treatment get better right away.
See, this is off and off.
Yeah,
I don't feel now.
I said right now, do you feel any now?
No.
No?
No, there's not.
Yeah, more of the arms up.
Mm-hmm.
It's good so far?
Yeah.
It's good.
Okay, this one that we treated no back pain.
Most are on this side, right?
Yeah, I heard down here.
Yes. And here, still from SI joints, this areas. Okay. Just 1 second.
Hurts a little bit.
Okay,
Is that
well,
better?
it's much better too, right? Okay, that's good. And then that, so maybe we just stop treatment.
So here that, that we always can achieve the immediate result after treatment, that finished. So that, it's very good thing for that. Okay, so maybe you will ask me that, what is the mechanism of MRA for pain treatment? So how does it work? And why do you think that's very good for the treatment, pain treatment? So first of all, we have to talk about the pathophysiological basis of MRI therapies, because we focus on that, that abnormal tension series, adhesion scar series, myofascial trigger point series, and three-dimensional meridian series, and then to rebuild up this kind of balance of our system. So this series, explains that the pathophysiological changes, development of pain, as well as the source and conduction of the abnormal tension. Through superficial, the blade needling, meaning acupuncture can release deep pain, restore tension balance, eliminate inflammation, and improve blood circulation. It can quickly eliminate pain and nerve compression to help achieve remarkable long-term results. Okay, so that the core mechanism of the MRA is that correcting the mechanical imbalance caused by soft tissue lesions and eliminate inflammatory reactive substances that cause the pain. Okay, and then through the body leverage, that the mechanical conduction or traction of the fascia and traditional Chinese medicine three-dimensional meridian series it is becoming possible to treat the deep lesions in the shallow superficial layer. Fernie considers the human body's repair function and self-regulation function, MRA, would maximize the self-healing capacity of the human bodies. Okay, so that is the benefit for that. So basically, we talk about 4 series of MRA therapy. One is abnormal tension theory, one is adhesion scar theory, and also my partial trigger points, and also 3-dimensional meridian series. We'll quickly go through it. Abnormal the tension series. So the tension usually that is kind of physical world, that represent the kind of that the force between that that the materials, and when we use it in our body, that we usually cause the tension too. Abnormal tension that, for example, any kind of soft tissue lesion, inflammation, edema, it will increase the internal tension. Muscle tissue damage, spasm, contraction, it will increase the external tension, lead to pulling pain. Other collective tissue damage, scar formation, increase the tension, tumor, burning, hyperplasia, etc. The nodule formation increase the local volume and size, increase tension. And also scoliosis or spina, curvature changes, the tons of the attached muscles of the transverse process and spinal process will change. Fractures, artificial joint replacement after surgery or fixed attached muscle lesion, tension will also changes. The texture of the skin changes, such as hardening and cooling, and increase in abnormal skin tension. That is I mentioned before, because skin tension is very important. Scar adhesion theories, that here soft tissue injuries, because we know that that when it's got injured, it will get inflamed, and then it has edema happens, and then the tissue during the repair process, and then scar tissue will form as a consequence of the healing. And soft tissue injuries also that it can cause inflammatory edema, and then that exudation of the surrounding tissues. And collagen fibers penetrate deep into the other normal tissues, blood vessels, nerve tissues, and then scar adhesion form, and then compression, pulling the normal neurovascular tissues causes symptoms. So that's cause of that adhesion. Here that kind of that the intractable pain scar adhesion from the pictures, the normal muscles like that, and then when it's got injured, then cause lots of scar tissues. And then when scar tissues increase, and then that it will increase the risk of re-injury and decrease the range of motion. And this kind of scar adhesion that can cause between bone to bone, bone to muscle, ligament, muscles and bone, and the nerves and blood vessels, and everything, that any normal soft tissues can be adhesive by the injuries, and then can cause lots of compression. Here kind of blown that in the tab just show that when scar tissue happened, and your muscles will function and shape will be changed, the function will change, and then that caused the problems. So my fascia adhesion, the fibrosis, scar tissues, people always feel kind of, that always don't feel right, feel kind of catching. Okay, and also that that anywhere in the muscle, tendons, ligaments can result in imbalance, degeneration, and compression and pain, because of that adhesion have on the surrounding the muscles and the soft tissues can cause the problems. So lots of people will that think scar adhesion will cause muscles to catch between each other, weakness in the muscles by shortening, repeated secondary injuries, and the entrapment on the nerve fibers and entrapment on blood vessels can cause the cold hand, cold feet, and also can cause local abnormal tension, cause the pain, cause the sensitive of the pain. So here that that adhesion can cause tissues and organs to stick together. So maybe easy to understand that part, right? So here the soft tissue secondary injury from scar adhesion formations, and then that it from acute injuries and repetitive injuries and constant pressure and tension, all from this kind of vicious cycles, that cause the problems. So if it can't break these kind of cycles, the pain will become chronic, intractable, long-term pain. So we have to, that get treated this to break those kind of, the vicious, cycles. Okay, and then that we talk about, that myofascial trigger points. Myofascial trigger points, that it is kind of hyper irritable spot, usually within the taut band of skeletal muscles. It's painful on compression and it can give rise to a, kind of referred pain, motor dysfunctions, and autonomic, phenomena. So this kind of trigger point in taut band. The taut band, that the muscles fibers shorten, they form the taut band here. This kind of also the nodules, you can find it from there. And contracted muscle fibers decrease blood supply, cause nerve irritation and pain. So this kind of trigger point complexes, our treatment, this all kind of, our treatment packets from mini-zinc acupuncture needles to directly to break up those kind of nodules and break up those kind of, that the taut band. We all know that the myofascial trigger point, it has, two different kinds of types. One is kind of active, one is kind of latent, that the trigger points. Active trigger points, I mean, most of the time our PT, physiotherapist, and massage therapists, to get treated. And also we have that, that the trigger points, that we also treat this part too. The characteristics of the active trigger point, it has pain, tender, swollen nodule, high tension, no pH, high acidity, high concentration of inflammatory pain substances, blood circulation disorders. Okay. So here kind of, that the chart talk about, those kind of chemical changes in the active and the latent trigger points, that the TNF, pH, L6, substance 10, and BKN, all those kind of chemicals is kind of we call pain chemicals. This chart, talk about, that the trigger points, skin, fascia is kind of, that the relationship when this have the trigger points happened, and also skin become as bulgy, local tissue, cutaneous humidity increased over myofascial points. So when you pipette, on skin, you can find, that the trigger point already. And also temperature differs from surrounding tissues. The skin displays reduced elasticity. So if you harder, the skin. And underneath of that is taut band contain trigger points under the skin part. Okay. So, and also skin adheres more tightly to underlying the fascia. So it feel more that, harder. And direction of the, palpations and taut band, you can feel like that, and relax the muscle fibers underneath of that. So when we just need to treat this part, okay? So it's very superficial. Sometimes people may be hard to understand what is the trigger point. So why that it is? So here, to my understanding, taut band trigger points are immature scar tissues. Yes, just like our cold sore. It's kind of scab, on top, but inside still swollen, still lots of chemicals inside, very painful. So this kind of trigger points. So they are kind of semi-mature scar tissues, because when cold sore got healed, the normal, pain, normal swelling, and also that the normal scar tissues. So that it is. So surprise, that is kind of, we understand that we call trigger points. So deep stroke by ball to smash the trigger points. Sometimes some physiotherapists, massage therapists ask patients to use a ball to deep stroke, want to break up those kind of, that the trigger points. Do you think it works? Maybe, but personally, I don't think so. And also it's very, very difficult, just like you use a ball to chop in the kitchen, that to chop the vegetables. Do you think it works? You can smash it when you use very hard, but you can't, cut it. So that's the problems. Okay, relationship between the scar adhesion trigger point and taut band. So from this kind of, that the chart we can tell the adhesion scar tissues, it causes the pain, compression, trigger points, tenderness and pain, all can cause abnormal high tension. And by the 3 meridians, the meridians, can spread it to either way in the local can cause local symptoms and also can cause distal, symptoms and then cause the pain. So what is the most effective method to break up scar adhesion tissue and trigger points nodules? I say mini zinc acupuncture needle with sharp blade is the best one. So I 100% sure that is right, that best one. So what is a sharp, that it looks like that? It's like flat head, called sharp blade needles. This one just, have a cat, that the effect. And also it has a needle stimulation that functions too. And three-dimensional, the meridian series, just to talk about, that all that, the pain can radiate it, all that the transport from local to far, that the distal, that the areas. So sometimes we treat the pain from the, neck, and then to treat the heel pain, or from neck to treat the low back pain, because of the also, and that the, pain can transport from the meridians. So that's the way. This is three-dimension, that the chart. Except my that 4 series and Dr. Hu, he's also famous, that the mini zinc acupuncture therapist in China. He has the biomechanic, imbalance series. He has, that one called one pole 4-guide wire span theory, one is ball string theory, one is the leverage theory, one is the myofascial link or chain theory. One pole 4-guide wire span series. From these pictures, talk about, in case some tension on this wires on the A part, because the system will hold the in the, that in the right position, and then when this wire tension increased, and B, C, and the D wires will get increased too, to that to guarantee to keep this pole in the right position. So just like our human body, if that IT band or IT band get tight, and then that not just tight on local part, also because our body want to keep the balance, and then that's the other part of the muscles, adductors, that flexors, and also that the extensor, these muscles, we all get maybe the tight. When this muscle get tight, depends on the body's that the pain sensitivity. Some patients maybe that because IT band get tight, they have pain inside of the knee, not just outside of the knee. Sometimes maybe they have some kind of pain in groin areas because IT band get tight. Because from one side get tight, and it cause another part of muscle get tight too. That's kind of that called the balance. That the problems. Ball string series talk about our spine. Our spine have the four the physical the curves from the cervical to the thoracic to the lumbar to that. So when that this bone, the bone structure has a kind of ball, and all muscles feels like so strain. And some patients that when an archer the jaw ball, the height stress size are a junction of the ball and strain, hand and the ball, hand and strain. So human spine has 4 curves like a ball, muscle behind the spine curves like strain. So if that the psoas major muscle is strained, the shoulder tight muscles will pull lumbar spine to make the lumbar curve smaller. Then the most stress side will focus on L1, L2, L5, S1. So from this series, if we treat the psoas major, that strain, what we can do, treat that, that we just need to treat on, that the spinal process of the L1, L2, L5, S1, this side, and then it will release that kind of psoas major muscle, that the tension and relieve the low back pain. So that's kind of we call the ball string series. And also from this series, we can tell all the kind of the topst part or lowest part of the spine always is most that the easy injured that the place. So when we get the treatment, we have to treat this part, and then to achieve the best result. Leverage series talk about that when that some we have that that leverage, and then this kind of materials W we need to move up, and then we can put force on the P, this one, and then relieve this kind of tension to make the balance. The F, just like that the in our spine, that we have spinal process, and then this like F, this like W, that when we have the tension on the transfer process, the muscular spasm, when that causes the pain, we can release that the spinal process tension from the P side, because this tension is collected. When we break up this kind of tension, and then this tension will be released. So from here, we can treat not of that the pain of the spine, beside the spine, that the muscle spasms. If the deep tissue muscle get spasm, and we treat the spinal process side, and then we can achieve the best result. We don't have to go too deeper, because of the risk to maybe injure the muscles, the blood vessels, and nerves. And my fascia chain series, just like that 3 meridian, the same thing. It talk about that the tensions can transfer from one part, from local part to distal part, and then can cause the distal symptoms. So for the treatment, if we know that the pain, for example, from heel pain, come from the low back or neck, and then we treat the low back and neck, and then the pain on heel should be getting better. So from there, we can know we don't have to treat the pain in head. Headache, we treat the head. For the pain, we treat the foot. We have to know exactly where the pain comes from and treat the cause of the pain, and then we can achieve the best result. Okay, so the benefit of MRA is that here that it can directly break up the scar adhesion tissues, which lock the muscle and joints, compress the blood vessels and nerves, and also can directly break up taut band and trigger points, drains out the biochemical pain substances from swollen hyper-irritable spots, remove compression on blood vessels and irritable nerve fibers, improves blood flow to promote the healing process. And also it can promote blood circulation, supplies more nutrients and oxygen into the injured muscles and tendons to help healing and recovery. And chronic irritable pain will be cured. Joint range of motion will be stored. Normal life will be back. So once it's pain-free, you will enjoy your life.
Okay, so that how do you feel generally after treatment? Everything is okay?
Oh, I feel great. A lot of the pain I was struggling with, it seemed to almost completely disappear. It was interesting because I could feel, the quick pokes, and then when you were touching it and it was sore, just like that, it's completely gone. It feels like almost 100%. It's great.
That's great. Okay, sure.
So that
Thank
is
you.
kind of patient that feeling after minimizing acupuncture treatment, because he come from the physiotherapist or no pain medical clinic. He did that dry needling. He just said that is almost nothing compared to dry needling. Okay, so of course the purpose today that we want to that promote on that our that the minimizing acupuncture therapy. So I say welcome to learn that this minimizing acupuncture therapy, become a doctor with a more comprehensive acupuncture techniques, and the treatment of common disease achieves a multiple effect with half the effort. And you are aware of how to treat difficult and complicated diseases, and become a top expert in treatment of soft tissue injury pain symptoms. So the purpose I want to learn this, I want to become the pain expert, pain doctor of acupuncture, because I believe that you cannot benefit from there. And okay, so right now that maybe we talk a little bit about that the clinic how to use this kind of acupuncture, meaning acupuncture to treat kind of diseases. First of all, for soft tissue injuries, okay, so that from here, that we can tell the clinical manifestation of soft tissue injuries, the pain, the nerve compression, physical dysfunction, and the autonomic dysfunctions. From there, we just go to that the cause of the pain and treat those kind of nodules, and then that the pain will get better right away. So how to do that? According to the local and the moment, locate the injured muscles, which may display tension, spasm, swelling, and tenderness. For the muscles, we are looking about active muscle, and also that the pulling the muscles, different kind of muscles, that what kind of pain. And is there any pain when the muscle contracts? Is there any pain when the muscles pulse back break up the tender nodules beside the burning edges. Most of the time, the nodules, that beside the burning edges, break up any abnormal nodule at the point of the muscle origin and insertion part, and break up the trigger points on the muscle spasm, taut band, and ligament. So when you get treatment on this part, your pain will be gone right away. To treat that nerve, that entrapment disease, same thing. You have to find the place from the patients, that complaint to find where's the location of the nerve has been compressed. And when you're looking for that part and you pipette, you find the nodules, you find that the hard part of the skin and soft tissues. Most part is that the treatment part. For example, if that we can treat most common nerve entrapment disease include greater occipital neuralgia, that the supra orbital the neuralgia, sciatic pain, cervical nerve compression, medial ulnar and radial nerve compression, tarsal tenor syndrome, etc. Yeah. So when we use that minimizing acupuncture to treat this kind of disease, it is very, very easy. Also, we can use a minimizing acupuncture treatment for breast pain. Lots of breast pain is difficult to get treated, but if we know where the pain comes from, and then that we can directly break up the scar tissues and loosen up tight injured muscles to relieve the high tension to help achieve the immediate pain-free result. So most of pain that we are talking about, that around the chest and the back, and then that we have the very detailed course to teach you how to treat those kind of disease. And also I use also MRA for COPD asthma disease because lots of muscles kind of that the breath related. If these muscles get tight, then we are that impact that this asthma and the COPD. And then as long as we can, to remove this kind of tension from abnormal the muscles, for example, anterior skinny muscles, diaphragm muscles, intercostal muscle, etc. And most patients feel better right away. And also we can use that, that the minimizing acupuncture treatment for the eye disease, colitis, and the deafness, because clinically that almost 30 to 40% ENT disease, and are caused by the cervical spondylosis. Okay, so when that that's kind of that for example, if the occipital nerve muscles are strained with the inflammation, spasm, adhesion, they may cause tension imbalance, compressed nerve and blood vessels, and then present a serious ENT and eye symptoms. For example, the first cervical transport process syndrome can cause long-term, that the pharyngeal discomfort, colitis, and the deafness, blindness, vision loss, etc. So when we can treat this part, and then patients, that the eye were getting better, vision were getting better, tinnitus were getting better too. So from here, that maybe ask how to do that. What's the step, of the MRI? Same thing. I say first of all, patient complaint. What's the complaint, and then patient locate action. What's kind of that the moment disturbance, and pulling pain and contracting pain, and then that find the suitable treatment positions, and then clean that the treatment areas, and then use fingers to pipette that where is that kind of that the abnormal tension part from skin, nodules, blah blah, and then use the thumb, index fingers, middle fingers to confirm the nodules from treatment and muscle spasm, and press the treatment side with your thumb, insert the that the mini needles to cut off the painful nodules. By performing that procedure, you should hear the cutting sounds. So cutting sounds like cracking sounds, cracking sounds like chack, chack, chack. You can hear the sounds. I mean, that's right for you. And after treatment, and when the patients, get up and then to repeat before treatment, the pain moment, and then to compare how the pain getting better or not getting better, or how much percentage getting better. And then if the patient, when repeat the moment, the pain there, you can ask patients, hold the position, and then that, ask patient to point out where's the pain. And then you can find exactly the point, another nodules above the pain part, and use minimizing needles to break that. Usually we can see the result right away. And how to find, MRI targets, this kind of usually that I say that when patient has pain in the local areas, we are looking for the pain treatment usually above the pain areas. Usually the cause always, that in the above part of the pain areas, because our body is kind of, the straight, that the working animal. So lots of pain, transferred from top down to the body. So if we just, follow the patients, that point out, always I say the patient may mislead your treatment because their pain is not really the cause of the pain. So we have to find, that where exactly the pain is. The precautions before treatment of the MRA. So of course, this is very similar to the acupuncture, that the precautions, that of course, if patient have some bad disease and cancers, whatever, we don't treat it. If patient is too, hungry or full, extreme tired, don't treat it. Or very nervous, don't treat it. If patient get pregnant, maybe don't treat the local part. If patient have the, bleeding problems, don't treat it. If patient have the skin that the infections, ulcers, tumors, maybe don't treat it. And if patient, have high diabetes, maybe blood sugar is very high, don't treat it. And also be cautious, to around deep insertion near the large, that the blood vessels and nerve, that be cautious, don't go too very deep. Of course, I want to say that acupuncture, using acupuncture has some kind of pain, but how to decrease the pain, that is very important. Because it has cutting, that benefit inside. That's why the pain a little bit more than regular acupuncture needles, but it's still tolerable. And also this kind of things you can help you to reduce the pain experiences. For example, when you insert the needles inside, don't repeat very fast. Maybe slow repeat treatment. And also that they should be inserted in very accurate place and depth. And when you hear the cutting sounds, and then that and your fingertips feels empty, stop treatment. And also another one that you have to get the right, very good quality of the needles. The blade should be very sharp, and then that pain is very, very nice. So our needles is very good actually. And also another way, right now I'm using in my clinic very often to use is give patients a candy during the treatment, before treatment, because candy help patients, that maybe reduce the pain sensations, and also patients, feel more, that delighted. I mean, with the candy in the mouth, and also seems that they are very, very comfortable to do that. And also that some doctors develop some kind of gun-like, devices, that, but I think that is very expensive and also still have some pain. Maybe we don't have to buy this kind of stuff like that. The after treatment of that, that MRI, what we should do? If any bleedings, press the part, maybe 1 or 2 minutes, just like a regular acupuncture, sometimes still can cause some bruises, that's very common. Don't worry about that. Tell patients that. And also that, if pain, that you worry about that, there may be infections, you can use that, the polysporin, and then to prevent, that infection. And of course, if your pain, if patient pain is very serious, because their original pain is very serious, and also you still can ask patient to take some painkillers after treatment, so no any problems. And of course, if treatment areas is kind of that swollen, you can patient can use ice, that to that put on the treatment part is okay. And also that after treatment, patients can do everything, except don't drink the alcohol. The treatment frequency maybe around 3 to 4 days. Sometimes patients maybe that complain after treatment, the pain temporarily getting worse. That's normal. Usually that I told patients after 8, maybe 12 hours later, the pain should be much better, and also patients will be getting much better. So far, any questions from that? What I'm talking? So you know that I want to quickly maybe talk about few disease, I really treated, that maybe give some examples, how do I exactly get treated. First of all, talk about, C1 transfer process syndrome. This is quite, that common, but maybe for this name, not the people don't know that. this is a transfer process, that here, the C1. It has, few that small that piece of muscles, inside. So this muscles is called oblique, that capitis, the superior muscles. This muscle is called oblique capitis inferior muscles. And also this muscles we call that the rectus capitis, the posterior minor muscles. And also this kind of, that called the major muscles. Okay, that's what we call that, that the occipital, that the muscles is deep, but it is main, that the impact of the balance, of the eye visions, of the headaches, that's a very important part. So when this kind of muscles get, that injured or get imbalanced, it will infect, those kind of, that the balance of that our position, and then can cause dizziness, vertigos, and tinnitus, eye issues. The cause, because I think bad, habits, and cause, that the muscle is strained, and also long time tilting head to watch TV can cause that problems, and also long-term high pillar sleeper can cause the problem. So C1 transfer process, that the manifestations, lots of patients will show dizziness, headache, tinnitus, deafness, mandible joint, that disorder, TMJ, increased pain when opening mouth or chewing, dry eyes, ironate, prominent eyebrows, and also trigeminal neuralgia, pain in the temple, one side facial pain, numbness, muscle spasm, paralysis, toothache. So it's quite, typically that on one side of the face, all kind of issues could be related to this kind of problems. So diagnosis, that from those kind of, symptoms, and then it can really easy to find pipette, kind of the bone, structures behind your ears, just, beside that your SCM muscle and also mastoid, bone. You will feel that kind of very sensitive, that the bone, the nodules, that on top of the bone. That is kind of, that the transfer, C1 transfer process, that part. The treatment, that I say when that we find it is the problems, we have to use that, that our fingers, that to pipette this part and hold it and then put needles directly to break up those kind of nodules here. And also in case, that muscle transfer process here, sorry about that, is here. And then we directly work on here. And also meanwhile, the pipette is this piece or this piece get tied. If this piece get tied, treat on the original part. If this piece is get tied, treat on the, the C2 transfer, C2 spinal process part. And then to release of the, kind of tied muscles. And patient should be getting better right away. Here, that's kind of case of the C1 transfer process cause of the, the optical neuritis, alopsia. So that's kind of ladies, that we get treated, and then that 8 years, of the headache, dizziness, blurred vision, and his disability from that, from this kind of disease. And after my treatment, that, and then that the 10 sessions, and then that her vision back almost to normal, and then she back to work. So before treatment, this kind of right eye, this left eye, the black part is kind of blind areas of her eye. After 5 sessions, get, almost 6% better. And after 10 sessions, 95% better. So, and after that, she's very happy. So he back to to work. Coracoid process syndrome. This is very common in women. Typically, that because the women have the the breast there. You have a big breast, and then pulling that the pec minor muscles, and also it has bicep muscles all connected to that the coracoid process. This is very common disease, and lots of ladies have the pain in the front chest. So if you don't know this disease, maybe it's hard for you to get a regular acupuncture treatment. But if you know that, it's very easy to get treated for that. Diagnosis, I say that patients come here, complain the pain on the chest part, either way on left side or right side. Some people maybe think about from heart disease, okay? But of course, for treatment, that is anterior and that lateral side of the coracoid process. So usually I ask patients to supine seating, in the chair. because some ladies have big, bras, and with the bra, when lie on tables, everything move up, it may be covered, that the treatment areas. Ask patients sitting there for treatment, and usually that's very easy. And also to pipette this kind of tender nodules and get treated. Usually after 3 or 4 sessions, most of ladies getting better right away. So that's very common. So our treatment, just focus on this part, and should be getting better right away. Let's learn that I will maybe talk about the prolapse, the tears syndromes. That is very common. Lots of people misdiagnosis as that the carpal tunnels, because when this median nerve get compressed on elbow areas, lots of patients show the tingles numbness, that on the hands. They believe that is kind of from that carpal tunnels. Actually, that if you pipette or checked up their elbows, that the median side, and then you will find very tender, very hard areas around these areas. Okay, because the prolapse tears, that the syndromes is a compression of the neuroplasticity of the median nerves, the elbow. It has 2 heads. One head is a humeral, one is the outer head. This part. So when it got this 2 muscle, this muscle got that it got injured, and this nerve got compressed. So treatment, we directly work on that, that the origin part of the muscles on 2 head, and also working on the muscles, the prolapse tears in muscles. And after that, patients should be getting better right away. But lots of patients, that during the treatment, they feel that oh, I'm getting better. I feel tingles, getting released right away. So that it is kind of excited, the moment when you treated the patient in the right place, and then the patient tell you. Yeah, so that's kind of that manifestations and diagnosis. That I don't repeat it. Generally, the patient feels the tingles, numbness, and elbow pain, and also that and also that the flexors of that wrist is getting weaker. So that's one. So treatment targets, that on that insertion origin part of the prolapse tears, from here and here. And also the trigger points on the top band of the muscles, on this part. Yeah, so that after you get treated, and the patient usually after 2 or 3 sessions, they should be much better. Lateral condylitis, that we call tennis elbow. That is not the people that are misunderstanding that, because they feel any kind of pain around elbow lateral side, they think that is kind of tennis elbow. Actually, it's not true, because we have 3 different kind of conditions could happen, from the lateral, elbow side pain. And that manifestation diagnosis, the tennis elbows, is a painful conditions that occurs when the tendon and elbow are overloaded. Usually, repetitive, that the motions of the wrist and arm, the pain of the tennis elbow occurs primarily where that the tendons of the forearm muscles attached to the bump of outside of the elbow. So that pain is associated with tennis elbow may radiate from the outside of the elbow into the forearm and the wrist. Okay, so that's the way. But here we have to analyze the features of the lateral, epicondyle, the pain. You can tell patients sometimes, they have 3 different kind of conditions. One that is pain occurs only carrying heavy object. The pain is located in the anterior and inferior aspect of the lateral epicondyle of the humerus. So this is not exactly that we call tennis elbow. It is kind of, that the problem from that, the bicep muscles get injured, because biceps, that works exactly to carry some stuff. So when the patient pain on this, that condition, we only treat, that bicep problem, and then that pain will getting better. Second condition is pain occurs when sweeping floor. The pain is located in the inferior and the posterior of lateral epicondyle of the humerus. So that is actually is caused by that, that the tricep, the muscles get injured, because triceps, the function extend our elbows. So if this, that the muscle got injured, and then that it will cause the problems. And the next one, the pain occurs when the pulling, the water twisting that the toe, and the pain is located on tip of the lateral, epicondyle of the humerus. This is a rear, that we call tennis elbow. Okay, so this one that we have to treat that the local part. So with our treatment, that on the lateral epicondyle of the humerus, and also on origin and biceps of triceps of muscles, if that pain from first two part, and then that directing this part because we know that exactly on the bone. This when we perform treatment, we can go to a little bit deeper, to directly go down to the bone. So that should be, a little bit painful, but after 2 days treatment, two session treatment, patient should be much better. Next one, I will maybe talk about tarsal tunnel syndrome. That is very common too, because lots of people that don't know, they just think that it's kind of, the heel pain, or that kind of, we call that, the plantar fasciitis. Actually, that if you treat just the heel pain and plantar, so that is, with regular acupuncture treatment, usually doesn't work, because I used to treat one patient with regular acupuncture treatment, and even that the 5 sessions, nothing changes. So after that, I noticed that it's tarsal tunnel syndrome, and then we use MRA, and when sessions, patient getting better right away. So here the problem is that tarsal tunnel syndrome, because of the muscles, we call tibial nerves, the posterior tibial nerves, pass through from here, from this one we call that the median plantar nerve, and down to the bottom of the foot, and then patients that cause pain on the bottom, and also on the the bottom of the in toes. Also, that if the nerves has been that compressed on this part, median, that the calcaneal nerves, and then patients have pain inside of the heel. So if this nerve has been compressed on this point, what we can do, just to use minizine needles to break up those kind of that scar tissues compressed on the nerve, the patient should be getting better right away. And meanwhile, sometimes patients may be compressed from this part, from the muscles and tendons. And also we have looking for this part too. If any kind of, the compression around part, and then this pain, we're getting better. So this is things, I want people to know that. Okay, so if you've never tried that, you can try that. You will see big differences. So this is diagnosis and the tarsal tunnel syndrome. So I don't have to read it, so maybe you can find it. Treatment, I told you already that ask patients that on the inferior posterior edge of the inner ankle, as well as the trigger point on the involved muscles, I say. And the supine or side 9 treatment is the same as usual protocols, just break up those kind of rogers or tender part, and then that sometimes patients will feel like electricity, that the nerve has been pinched, but as long as your treatment, that the direction of the knife blade, follow these directions, you don't have to worry about that, injure the nerves. Okay, so don't worry about that. Next one I will maybe introduce a little bit, we call lower cross syndrome. This is very common right now, that lots of people have that, either upper cross syndrome or low cross syndrome. This low cross syndrome, that because we have tight, that the lumbar, extensors, and also tight hip flexors, have weak abdominal muscles, and also that the weak gluteus maximus muscles. That can cause patients, that have a big tummy, and also very, that big curve of the lumbar curves, and patients, that most of the time combined with upper cross syndrome. So for treatment, for minizine acupuncture treatment, we focus on tight part. We tight, that the circular lumbar extensors, and also we treat, that the hip extensors. Here you can see that usually patients have the upper cross syndrome, has a low cross syndrome. So we treat that the tight part. Okay. Here that that just yesterday, Friday, I treated the doctor. He's at the medicine doctor in our local hospital. He has very typical, that no crossed syndrome, and I give him treatment. Actually, he has been here almost the few sessions now. She feels much better than before. Right now, he can walk dogs, a few hours without any pain. Before, he couldn't do it at all. So that here that I just take videos and then just share, that you guys. This part we treat that that tight flexors of the muscles. Usually that we treat the biceps, femoris muscles is the main that the quads muscles, tight flexor. So we treat that part. Because I said already that when the muscle get tight, usually their skin get tight too. So as long as we pepper the skin, tight skin, and then we know that the tight muscle is underneath of the skin. So we directly just break up those kind of nodules on the skin or underneath the skin. It will release the tension from the muscle. So for this treatment, we don't need any deeper, just very superficial. Sometimes I feel my fingers, that maybe the index fingers or mid fingers more sensitive than my thumb fingers. That's why that sometimes, typically on the skin part, I use my index fingers and the, and the middle fingers, that to pepper the patient's skin instead of using thumb, go very deep. Because his condition has been many years, so that's why every time we treat part of the problems, and I really want to help him to achieve the best result, because he is our main doctor in our the COVID-19 emergency room. Doctors, he saved lots of patients' life.
Okay. No problem.
Yeah, this one we treated on the back part, the extension muscles, that I think how many minutes? 3 minutes. Yeah, first of all, that I go go through that the spine, that go to spine the process, to find that the tight the part of the spinal process, beside it has of tight nodules beside the spine. We have to use these needles to break up those kind of tension. And then that after that we work on the muscle directly. So this one that I use my thumb just sliding, on skin to figure out, that the nodules are in a high tension part. So this kind of therapy is very objective, because as long as you feel that under skin you have some issues, that's the way you will get treated. So that's why you don't have to guess, that it is the thing where the problem is. So that's why that you should feel very confident, comfortable to give patient treatment. Just sliding, the skin and the muscles and find, which part is tight, and then get, to treat this kind of high tension, the skin and the muscles. Okay, maybe we can stop, go to the next one. Actually, that lots of ladies, lots of people ask me that, can we use the minusing acupuncture to have a weight loss? Actually, yes. Actually, in China, lots of doctors use this kind of needles to help to lose weight. Typically, that they use that, they use this needles to stimulate those kind of the points we always use to lose weight, and also we can directly use this needles, this needle to break up those kind of fat tissues, accumulated, the part, and then directly to break up those kind of fat cells. So it works very good actually, and the patients feel maybe very comfortable. If you use that, maybe every time you can see the inches differences from that, this kind of treatment, instead of just use the regular acupuncture treatment. And also that lots of doctors in China use this treatment for cosmetic, for wrinkles and the scars. So actually that I treat when two people generally. I'm not specific for this part, but I think that it works very good too. We can use minusing acupuncture needles, to cut off the scar, fibers underneath of the wrinkles, to remove wrinkles, to make the beauty. So I know that some doctors, in China, they make big money from this kind of techniques, because they don't, some ladies that don't want to use any injection, and then that they want just natural way to make the beauty, so they make huge money for that. Okay, so that the next one I will maybe introduce minusing acupuncture training process. That this is the purpose of today. Actually, that from 2019, I have 3 training classes in my clinic. That after treated, and every student actually worked very well. I always contact them. They are still using that minusing acupuncture every day for their patient. So it works very, very good for that. And also I have training classes, during the conferences, that in Vancouver, Toronto, and San Francisco. And also some, students, that they are using that. It works very, very good too. So that's why that I'm happy that, proud of them. And also that the 2020, I have the PT training classes in Winnipeg, that I get, around the 10 people attended this training classes. And I get some feedback from them. It seems to work very well. So they always use that in their practice. Okay, next one that maybe I asked maybe that Miss Nori, the N, he was the attendee that in my training classes of the PT. I'm wondering that Nori, are you there? Nori?
Yes, I'm here.
Okay, so that the time is for you. So can you just give us the few words about your experience and feedback of this kind of treatment?
Yeah, sure. So I've been using the mini Ren acupuncture since 2020. I'm a physiotherapist and I work 2 days a week. So most of the people I see have neck pain, low back pain, lateral hip pain, medial knee pain, and shoulder pain. And I found it's very beneficial to increase movement, decrease pain, increase function, and increase energy. And usually the results are like right away, definitely as far as increasing range of motion and decreasing pain. And I find that this allows people to be able to do their exercise more easily, that they, and even if they aren't good with exercising, they just feel better functionally. They can walk better, they can climb stairs better, they can reach better. They actually can sleep better because they can lay on their sore hip that was previously sore anyway, their sore shoulder. And so that gives them more energy. and helps them with healing. Recently, I had a patient who, like just last week, I was treating her for her shoulder pain. She couldn't put her hand behind her head. And so I treated her infraspinatus right along the medial border of the scapula. And she left. And when she left, she was able to put her hand behind her head. And she could put up her pigtail, which she couldn't previously. And when she came back a couple of days later, she said that she had incredible energy about 4 hours later. She made supper, she cleaned up she's a school bus driver. She cleaned her school bus. She went cutting wood the next day. She hadn't been doing that for a long time, which I found really interesting. And the same with one of my other patients had knee pain, long-standing knee pain. And I treated her gluteus medius and minimus and her piriformis. And that really improved her ability to place her left ankle on her right knee, which she couldn't do prior to me doing the mini Ren acupuncture. Plus, her medial knee pain was much less. And I treated her about 3 times. And the second time I treated her medial collateral ligament, the origin and like either end, proximal distal end of the ligament. And that again improved her ability to place her left ankle on her right knee and with no pain. And actually her walking was significantly better. And that was in May. And I treated her 3 times and she hasn't had any troubles to date. And that's about it. And I would strongly encourage people to learn this technique because it's very beneficial. It's quick. You get quick results, and which makes me very happy. Thank you, Dr. Ming.
Okay, thank you, Laurie. Thank you very much.
you're
I mean that, you
Yeah.
give us very, very good, that the testimony and the feedback for that, for this kind of therapy, because I say that after training, I get lots of very good feedback from there. And that maybe I don't talk about too much about that because Laurie or that include everything, because I get this kind of testimonials from different kind of that peoples. So they always very good, very good result from that. We WhatsApp, app, we have a group, that we share that the experiences for that. So and then that seems that very, very happy for that. Okay, so that for my training the courses, we have online training. So we have that that total 18 lessons, that to learn from the general, and then from the head, face, neck, shoulder, and upper body, lower body, and then that everything. So I believe that after you learn from this course, you can treat the whole bodies. The issues, that actually that I say my training course, I don't have any kind of stages from the the primary and the middle and high levels. I just have one level. After you learned, I'm sure you can practice right away. So that I don't want to spend too much, waste too much time and money to learn that. This one-time training and the one-time you will get a result. And one-time that you can get that the benefit for that. And we treat hip, side, knee, and treat foot, neck, foot, ankle, everything. And here that I say that because usually we charge around $1,500 for the course, but today I would like maybe that offer you guys very, very special price, only 798 Canadian dollars, and only for today's attendees only. So you will save $100 for this kind of course. Plus, I will maybe send you maybe free 10 boxes of mini zinc acupuncture needles. That each box have 100 needles. It will last around 3 to 6 months to make sure you have enough needles to practice that in your clinic. So that usually that we charge around $300 for 100 for 10 boxes. But today I give you free. And also I keep free shipping. Whatever you are, wherever you are in Canada, in States, and in Europe, I give free shipping. So that we maybe save another maybe $50 to $100. We give you check numbers, okay? And also that we have free taxes, that I don't charge taxes at all So that's only that today's, that the benefit for today's of the attendees. If you any person want to learn to register this kind of courses, you can go to, the chart. We have the link, that link, that in the chart, and then that my assistant will help you that to go through that everything, and then that you get registered, and then you start to learn right away. So actually, that the total is almost $1,100, for this kind of course. So that's, I think that's very big, that benefit, for you guys. I guess maybe don't miss it if you really want to learn that. Of course, if you don't want to learn that, doesn't matter. I mean that we can maybe that talk about in the future. More benefits today that if you learn that these courses, we also have supply free Zoom meeting tutorial, once every 2 or 3 weeks. We are answer all questions. If any question, if you have any questions or anything, case studies, want to share, or and then that we have once every 2 or 3 weeks. And also we have free to attend MRA seminar. So we still have more seminar in the future. You are free to attend this kind of seminar. And also that you will receive updated teaching videos, I do, because every patient comes to my clinic, if I feel that very, very interesting cases, I will take videos and then that show the treatment and share this kind of, that my experiences with you guys. And also that in the group, we also that, that help, people, that to share their stories, and also that I would like maybe invite you guys, that whole my students, to attend MRI related international conferences, because I know in China, we do have lots of, conferences, and also in Canada, we organize some kind of conferences too. And yeah, so that you can go to the course registration link in the chat box and join now, okay? And here, and another one about this leader. We have that, leaders, that we are the only the distributors in Canada. And also that's this kind of from Health Canada. And we call that, flat head leader. That's kind of registered name for that, that imported. And the English name, the brand name is called Zabu, is a marked brand name. And Mini Zenzhen is our Chinese name. Okay, so I want you to understand that it is. Okay, here is kind of, that the leaders, what does it look like? It likes, that the box like that, and inside we have the 5, each one, like 5 meters. And here that kind of our, that other, information, and the name and the phone number and website, everything. Okay. And if you have any questions, please ask me and or type in the chat box. Thank you very much. So please register online calls in the chat box. And we are using, your billing address as the shipping address. If you have any different options, please text 1-431-588-4888. The next one that is our kind of, that WhatsApp group. We have a WhatsApp, the MRI study group. If you have a WhatsApp, that account, you can scan my that code and then to join us. Any more questions do you have?
Dr. Huang, there is question in the chat box.
Oh yeah, I'm just looking for now. That's the last I heard that this type of leader is still not permitted in the United States. Do anyone know if this is still true? To my knowledge and my that information, I believe in the United States still lot of people perform this kind of treatment. As long as it is safe and the procedure should be okay, because of the generally the same in Canada. No any association or college say that acupuncture type of acupuncture needle is what, because this you can treat as dry needling. So same thing, just because these needles have a tiny blade on top, that's it. So I don't think that you have any restrict, to this type of treatment, because I know some kind of treatment we call P needle. It's also kind of same, that the blood needles, but they call name called P needles. Okay, this one we call mini Zen needle. We don't call it live needle. So the name the issues, but the most important is that your practice. If your practice is that the safe, the result is very good. Maybe nobody care about that. If you have a troubles or you make some kind of injuries, of course, any kind of needles, you will have trouble. Just like I have a friend told me that he's at the practicing in the States, and he's at his that happens last year. And yeah, we have the same conferences, and he told me, "Hi, Dr. Wang, in States, that some insurance, company or some lawyer, they're very, very curious for that, because he has patients just after his treatment from his clinic, a lawyer call his clients right away. Do you have any injuries? Do you have damages? If you have an injury or damages, I can help you to sue the doctor." So that's a very, very, the curious things that you guys have to, take up of that. As long as it's safe, of course, you have to, prepare everything to make sure your patient understand what they are doing, and then ask patient to sign the consent form, and then I believe that they are safe. Otherwise, that I know some patients, that maybe, some lawyers, really want to make some business, that always, even for regular acupuncture, they're always looking for some troubles. If they have trouble, and then maybe that they want to get some business. So that's kind of things very serious. So in China, in Canada, I think that is that it's not bad as in the States. But anyway, any clinic of the world, safety always number one. If you have troubles, you always have troubles. So doesn't matter any kind of needles, you use. Dry needling, same thing. If you have troubles, still maybe that get trouble. Okay, so that is my answer. And any more questions? Okay, let me stop sharing. Okay, so that if you look questions, maybe that the end today's at the conferences. And of course, if you have any questions, you are welcome, that to join our mini Zen study group. Is a WhatsApp, and then that we are keep contact. Okay.
Sorry,
so
Dr. Huang, I have
Yes.
one more question.
Sure.
Someone just messaged me and she asked how much do the needles cost?
Usually that we sell right now that 10 boxes, for example, we charge $300. That's almost just like $30 per box, per 100. Did you get it, Cindy? Okay. Yeah, per box we sell maybe $39.95, but if you buy the 10 boxes, we have $300. Of course, if you join this course, we give free 10 boxes. Okay, so that if no questions, maybe we will end today's meeting. Thanks you guys to attending. And then that Annie, Dust, do you have questions, Annie? Can you turn on your speaker if you have any questions?
Hi, Dr. Huang. No, no, really, I was just wondering about the course. I went to your website, and it's pretty late here, in 3:30 a.m. in Australia.
Okay, yeah, you're from the Australia. Okay.
Yeah, thank
I'm
you
so
very much for
excited. That
your,
means that you stay here. That's great. Thank you.
yes, thank you very much for your, seminar. I really enjoyed it. But I was extremely tired as well at the same time. But however, I'm in your website in the morning, in the afternoon, or in the morning when I get up. I'll have a look thoroughly. So I'm pretty sure that I really like your course, and then I'd like to get your course.
Sure. Because before you asked me that the prices, that time haven't changed yet. So right now that we give you a very big discount for that. I mean that you really want to join that, maybe it's a good time to join that, and then that you get lots of benefit, and also you get free 10 boxes of needles, and maybe last around 3 to 6 months. You can use that.
Yeah, true. This needles, can you? Is that possible for you to send those needles to Adelaide, Australia?
Yes, I say that whatever you are, wherever you are, we send that to you with that that tracking numbers too, to make sure. I know when we send to Australia, maybe cost maybe around 80, 90 bucks, from Canada to Australia. But anyway, I would like to spend money. I would like to send needle to you. I really want to help you to use that.
Yeah, thank you. I really appreciate it. And for the future reference, if I need more needles, do I have to contact with you, or I can get it from somewhere else?
I guess this needles just right now that in Canada we can, otherwise you have to go to China to order. But the qualities, I can tell my quality is much better than the order from the China. Because before, when I have this kind of brand that needles, I ordered some needles from China. Actually, that last week I dumped all of to the garbage, because when I use them for my patients, it's very, very painful.
Okay, all right, got it.
But don't worry about that.
Anyway,
That if you need more, that in future we still can give some the discount for my students. Don't worry about that.
no problem at all. Thank you very much. I really appreciate it. Have a wonderful day.
You too. Okay, have a good night.
All right, then.
Have a good dream. Have a good dream.
Thanks. You too. Yeah,
See you.
bye-bye.
Bye-bye.
Bye.
Okay, any more questions? If you don't have any, that maybe we will stop now. 行了，我们可以结束了哈。